Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. Today's focus is on pulmonary camp in my pulmonary lecture series. Lecture series number 1, Vitals and Pulse Oximetry, Factors Affecting Pulse Oximetry. I can be found on Instagram, Facebook, Pinterest, Google, Etsy, and social media as Nursing Kamp and NursingKamp.com. So let's get into it. I'm going to be covering about these sticky notes found on nursingkamp.com and social media. And more importantly, we're going to look at this one today. Now, pulse oximetry is a probe that is put on the finger, and it's positional. So when it's on the finger, it's going to give us a pulse oximetry reading, and we want that reading around 96 to 100. And what is it reading? Well, it's reading the hemoglobin, okay, and the oxygen capacity, the O2 on the hemoglobin. And so that's an important piece, because when we're looking at the reasons of it not showing up, blood is everything. And that could be one of the factors that will affect it. All right, so let's get into those factors. So one of the first ones we're going to look at is hypotension. Well, hypotension is decreased blood pressure, and it's going to affect the pulse oximetry because what's the underlying cause for the hypotension? If a person has decreased blood volume, or there's factors that are vasodilating it, you don't have enough circulation into that finger. And when you're looking at the finger and you're putting a probe onto it, it's not going to be able to get a full accurate reading. So you're going to have a lower reading. How do we know it's hypotensive? Because decreased blood pressure, decreased mean arterial pressure. The next one we're going to look at is hypovolemia. Now, hypovolemia is low fluid volume. And fluid volume is important, just like with blood pressure. If the fluid volume and the blood volume is not there, as in hypovolemia, once again, we cannot really accurately get a valid pulse oximetry. Another reason is hypothermia. Now, hypothermia causes a lot of reasons, because you need blood flow, and cold fingers causes vasoconstriction. And when you have vasoconstriction, you have less blood flow and volume going through, and the sensor can't really pick it up, so you get a false reading. The next one is carbon monoxide. Excesses of 1 to 2% of carbon monoxide will falsely decrease that patient. Next is anemia. Just like with blood volume, anemia is not enough hemoglobin. So in a CBC, we're looking at a hemoglobin and a hematocrit. And this hemoglobin, it's in my previous lecture, for females should be 10 to 14, and male should be 12 to 16. And if it is low, it might be affecting their oxygen saturations. The next is Raynaud's. Now, Raynaud's is peripheral vascular, and the interesting thing about Raynaud's is that it causes vascular constriction and decreased blood flow to the extremities. So how this would work on a NCLEX style question is the patient submitted with Raynaud's and has a pulse ox of 92%. What's nursing priority? Well, nursing priority would be stating that, well, Raynaud's is a normal findings. So look at the patient. So we assess before we implement. And the assessment is the Raynaud's told you that, well, you'd need to know that Raynaud's would cause a false decrease of O2 saturations. And the last thing is pigmentation. If there's changes of pigmentation on the skin, you might want to reposition that pulse ox. So some quick overview. So we have 96 to 100% is a normal pulse ox. And when we see pulse oximetry in an NCLEX question, it's there for a reason. But when we see less than 96%, it might be these causes first. So we always assess before we implement. Generally less than 96%, we are always going to put that patient in a high Fowler's position. 90 to 95% is we look at these underlying causes. But then we also, it is still acute. So we still want to assess that patient. We just don't let that patient go with a pulse oximetry less than 95%. If a patient has less than 90% of pulse ox, you stay in the room and stay with the patient. Keep them high followers, ongoing, get vital signs, and look at oxygen saturations and look at your patients. Look at your hemodynamics. So less than 90% is always acute. Another factor we're going to talk a little bit later is a patient who hovers in around 92%, 94%. Now those patients might be a COPD patient. That's covered in another lecture, and we'll address that issue later. But just understand that 92-95% you see COPD with that. We're going to look at that a little bit more closely on the assessment. Less than 85% is always acute and respiratory distress. And you should always be in, especially with the NCLEX. If you have an oxygen saturation of 85%, that's acute. And we assess that patient. Well, that about does it. That's my first pulmonary lecture, just kind of covering pulse oximetry. We know we do vital signs and we look at that pulse oximetry, but there are some factors that could affect a low pulse ox. And that's about it. You can find this sticky note on Instagram, Facebook, Pinterest, Google, Etsy, and also nursingkamp.com. That's it for me. No Nurse on, and we'll see you next time.